Heidi Blomqvist. I'm a doctoral researcher in health sciences at Åbo Academy University in Finland. And I'm very glad to be here today with you and want to thank you for all the beautiful presentations that have been given today here. So I come from a nursing background, primarily in home care. And in this setting, I've had the privilege of engaging with a multitude of life stories, each one a blend of joy and sorrow. And working directly in people's homes offers a unique opportunity to cultivate deeper connections if one allows. So reflecting on my time in home care, I often think about these individuals I've had the honor to serve. And one common challenge in healthcare, including home care, is the perpetual shortage of time and the consequent stress it places on caregivers. And it was stressful in home care as well. And I'm going to tell you about one occasion that has etched itself strongly in my memory. So I had promised to deliver medication to a client that had run out, but I didn't have an actual visit planned for this client. So I was just passing through on my way to another client. And at that moment, I was in a hurry. I dropped off the promised medication and exchanged a few words, checked so everything was okay with the client. And this client had always described me before as kindly, warm-hearted, professional, and thorough. And the next time I came for a visit, she said to me, "You always seem to be in such a hurry. Last time you were here, you didn't even have the time to take off your jacket." And in my mind, I could recall that she was right. It was an unintended act that my client saw as disrespect. And this served as a stark reminder of the importance of genuine engagement. And since then, every time I entered a client's home, I made sure to take off my jacket and sit down, even just for a minute. So why am I telling you this today? This reflection isn't just about personal anecdotes. It speaks to a broader issue within healthcare. It underscores the need to prioritize human connection amidst the daily demands of the profession. And in fact, it is this very aspect that I aim to explore in my research, the significance of compassionate care in home settings and its impact on overall quality. And ultimately, it's about recognizing and valuing the human element in caregiving, ensuring that each interaction goes beyond mere medical tasks to foster meaningful connections. So today I will present my research here on ethical sensitivity and compassion in home care as central aspects of care quality, the perspective of home care leaders. So why this research? As you all surely know, and also has been mentioned here today, the elderly population is increasing. And this naturally raises the need for home care resources. And according to research, several countries already struggle to provide home care with the type of care that the client needs. Home care personnel have been singled out as one of the factors that can give older people meaningfulness in home care. And it is suggested that the performance of care has a bearing on the quality of care. So that means that when it comes to quality of care, care is determined not only on what it is, but also on how it is performed. Home care leaders therefore have a significant role as their influence on other healthcare professionals, closely related to the organization's ethical environment, can affect the well-being of caregivers, which in turn will affect also the quality of care in home care. And compassion as a basis for care, ethics, it guides caregivers and care organization. And it is also important at the organizational level to recognize the importance of compassion in caring, as otherwise compassion risks being stifled by the environment. So, compassion and ethical sensitivity is two of the things that are included in this study. And compassion from a nursing science perspective means a feeling of pain and concern for others' difficulties. It is one of the 5 values that ICN requires a nurse to have and can be seen as the basis for ethical codes of care. It is therefore essential in healthcare. Compassion is described as the heart, the fundamental of caring. Ethical sensitivity. That involves recognizing and interpreting the ethical dimension of a care situation as the first aspect of decision-making in professional practice. And ethical sensitivity thus encompasses the caregiver's ability to recognize an ethical dilemma or ethical aspects in a situations. So the purpose of this study, it was to explore the home care leaders' perceptions of ethical sensitivity and compassion and associated with quality of care in home care. And therefore, the participants in the study were home care leaders chosen to gain this comprehensive view of the subject. And the research questions in the study were: what are home care leaders' experience of ethical sensitivity and compassion in home care? And how do they perceive that the ethical sensitivity and compassion influence home care and its quality? And over to the findings here, to the results. So an overall theme and 4 main themes emerged from the analysis, and these can be seen here in the figure. And the picture shows the importance of the interaction between the caregiver and the client, as well as how ethical sensitivity and compassion belong together and support each other. The overarching theme were compassion provides deeper meaning, and ethical sensitivity provides means for knowing how to act. And this overall theme shows that when ethical sensitivity and compassion are present in home care leaders see that a trusting relationship between the client and the caregiver can be established. And they perceive ethical sensitivity and compassion as competencies, as that the caregivers in home care should have, as they believe these competencies create deeper meaning for the care relationship for both the client and also the caregiver, while also enhancing the value of care. So ethical sensitivity is what helps the caregiver to be responsive, to recognize what is meaningful for the client, while compassion is what makes caring meaningful for both the client and the caregiver. And this first theme, co-creation between the caregiver's responsiveness and the client's needs. It's about the interaction. Ethical sensitivity is a cornerstone in home care when it comes to entering another person's home. And care can therefore suffer if the caregiver does not have the necessary prerequisites. One of the home care leaders said in the interviews that ethical sensitivity is quite crucial to whether or not there will be continued care. If the client feels that we are violating their life situation or their lives in their own home in some way, they can end home care even though the need exists. So ethical sensitivity, as understood by home care leaders, involves being responsive to the client's real needs. Through ethical sensitivity, the caregiver is responsive to the client's suffering, vulnerability, and can adapt to the situation and convey compassion in actions that can best alleviate the client's suffering at the moment. Through ethical sensitivity, the client can feel listened to, heard, and empowered to decide for themselves about their care, their home, and their life, which is important for the quality of care. If caregivers fail to be responsive to the client's needs, qualitative care cannot be achieved, because then they have missed starting from what the client needs at that moment. So the second theme, that describes compassion as seeing and acknowledging the client's suffering. And it is also there that the compassion is clearly intertwined with ethical sensitivity by understanding the client's situation and conveying compassion by listening, being present, showing care, touch, and love. These actions that can alleviate their suffering. So compassion conveyed with ethical sensitivity creates trust and warmth in the care encounter, enabling a trust-caring relationship. And when care is performed in consensus, care also runs smoother, according to these home care leaders. So by showing compassion for the client through attitude and action and being fully present in the moment, the caregiver shows that they value the client as a human being. This care relationship is significant as home care visits may be the only human contact some clients have during a day. The care relationship and the co-creation in care that the relationship entails make care meaningful for both the caregiver and the client, which also enhances the value of care. So if the client suffers, no one takes time to show this compassion, it creates even greater suffering for the client, which directly affects then the quality of care negatively, as home care leaders see that it can cause anxiety and insecurity, so that the client's care needs increase. One home care leader explained compassion as the caregiver's greatest tool. It is where care begins and where it ends. So care with compassion can provide the client with security and thus also influence the possibility of continuing to live at home. The third theme is about ethical sensitivity, compassion as these competencies that can be developed and also the need for support. The home care leaders in the study, they believe that the most people who have chosen the caregiving profession have a certain level of ethical sensitivity and compassion in their caring, but that there is probably a need for competence development and above all also a need for support to handle the compassion. They see ethical sensitivity and compassion as abilities linked to one's personality that can be developed and strengthened through knowledge and experience. And to be able to have ethical sensitivity, several of the home care leaders believe that the caregiver first needs to feel secure in their professional role. And through life experience, professional experience, and support in various forms can then the caregiver develop their ethical sensitivity and compassion. So home care leaders see compassion as feeling with someone in their suffering and vulnerability, but that as a professional caregiver, one also needs to be able to set a boundary for compassion so that it does not create suffering for the caregiver. And this is one of the challenges that home care leaders saw, that there are caregivers who often want more than what the resources allow. Then there are also a few caregivers who do not have competence in this area due to, for example, inexperience, personality, lack of commitment, or just unwillingness to learn. And besides causing personal suffering for the caregiver, it can also affect the caregiver's ability to provide care. And this also results in the care providing being different, which affects the quality. So the healthcare staff need to discuss more and need support both in handling and conveying ethical sensitivity and compassion. More discussions within the team and support regarding ethical sensitivity and compassion would be needed. And the final theme here is about the organizations and home care leaders' role in directly influencing the possibilities of seeing ethical sensitivity and compassion as resources in home care, and by maintaining then a compassionate work environment and ensuring the well-being of the staff, and meeting the need with the adequate resources. And these are related as, according to the leaders, resource scarcity can affect the caregiver's ability to provide time, care, and show compassion to the client. And if the planned time for the visit is short, then it may mean that the caregiver is responsive to the client's real needs, but they cannot meet them, which then creates anxiety in the caregiver. Resource scarcity can mean that the care become routine, that the client's needs are no longer at the center. It can cause problems, mistakes, which in the long run then can lead to increased care needs. So it is therefore seen as very important that the organization provides sufficient and appropriate support to the staff in home care. How well these things are supported affects the care provided in terms of quality. And the organization, together with the leader, can also influence by creating this supportive environment that encourage ethical sensitivity and compassion just by seeing these as resources. The competence and willingness exist among the caregivers, but the resources provided by the organization are not always sufficient, according to the home care leaders in the study. Some home care leaders argue that they themselves have an important task here in creating a work environment where values such as ethical sensitivity and compassion are included and also visible in this work environment. And the organization's role is to support the staff's well-being by meeting their needs and providing adequate resources in home care. By discussing ethical sensitivity and compassion in the workplace, their presence can become more evident in daily work. So, for example, workplace training on the subject, workshops, or regular ethical discussions are things that home care leaders highlight as these supportive measures that could positively influence the caregiver's competence regarding ethical sensitivity and compassion. So, the result of the study showed that home care leaders perceive that ethical sensitivity and compassion influence care quality. The study found that home care leaders perceive the ethical sensitivity and compassion as competencies that caregivers in home care should have, as they believe that these competencies create a deeper meaning for the care relationship for both the client and also for the caregiver, while also raising the value of care. If nurses fail to be sensitive and compassionate with patients, good and high qualitative home care cannot be achieved. So from the caregiver's perspective, it can be seen as an added value to care with compassion and ethical sensitivity, as it can elevate the purpose and meaning of caregiving. Further research on the subject in home care is needed, but much indicates that these included in home care could be seen as cost-effective from the organization's perspective as well. So the study provides an understanding of the meaning of ethical sensitivity and compassion as sources of strength and their link to quality of care in a home care context. And the result of the study thus shows that the organization and the leaders have a significant role in creating a work environment where ethical sensitivity and compassion are present. The leader's responsibility is to create such conditions that support this mission. Yes. Thank you for your attention. Here you can see also a link to the article that is published in Nursing Ethics. Do you have any questions?